So Kevin, now I'd like to focus a little bit on the mental and or physical conditions or symptoms that you're experiencing.
I have a long story to this. I guess on the basic level, I have what's called hypermobility Ehlers-Danlos, which basically means my joints are loose and can injure easily. And then I had 3 childhood injuries that have now manifest themselves as pretty significant as I approach 50 and everything is kind of going arthritic. First, we'll start at the bottom, I guess, is a tailbone injury that set up a stage 1 spondylolisthesis and has turned out to have done nerve damage to both my legs, the left one the worst. So my legs fall in, my arches collapse, and it becomes very painful standing and walking. And then sitting, we'll get to it, as my head is also a difficult position. But sitting will also then put my legs to sleep. I just had lumbar surgery, so we'll see if that kind of goes away. Still just had that a couple months ago, so it's kind of fresh and new.
You're still in recovery from that one.
Yeah, still recovering from that.
Yep.
In my midsection, from my thoracic vertebra T4 to T7, another injury where I jumped off a wall and spun and actually landed flat on my back. That's what's called osteophytic autofusing. So my 4 vertebrae are kind of fusing themselves together on their own. And that's where a lot of, it seems my anxiety is coming from. It's sort of an interface between the sympathetic and the parasympathetic nervous system, as far as I can understand it. I'm not a doctor, so I'm a little out of my wheelhouse here, but basically there's bulging discs and arthritic growth that's interfering with some of the nerves there, and that's causing majority of my anxiety. I take amitriptyline for anxiety. And then there's the primary region is my neck. And I was hit by a sailboat mast that came in basically from the left side. And so my neck has kind of this twist or slant to the right, and my spinal cord goes off to the right and then arches back around by about T6. So it has this sort of twisted form to it. With that is a lot of what they call instability. So it's torn or injured or lax ligaments that hold the cranial-cervical junction together. And that's basically holding your head onto the top of your spine. So it's C1 and C2 are the primary junctions there, which control your ability to rotate your head and then nod up and down. I have fused my spine now from C3 to C7. And that happened from 2018 and then 2019. So it's 2 fusion surgeries to fuse that whole block together. And I'd say from that, it's good. And I guess talk about my ribs too. I'm losing it.
That's right. Thoracic output. And
So 5 years ago is when I started getting a whole lot of radiculopathy, which is pain down the arms and numbness down the arms. And it was from a combination of things. One were nerve roots getting pinched at my spinal column, but it was also then enhanced by nerves getting pinched in the brachioplexus of the space between my first rib and my clavicle was too small. So it's basically kind of like a scissor when I would move around and it would pinch those nerves. I would often wake up with dead arm, where your arm is just no response, it's completely numb. And actually dislocated my shoulder twice in my sleep and injured myself in yoga doing a side plank. So at that point, had my first rib removed on the right side, and then a year and a half or so later had the first rib removed on the left side. Then had to go in and repair the right side because the guy who did the first job on the right side left some spiky bones sticking out. So we had to clean that off. So I had a lot of excess scar tissue and nerve damage that was happening. So my whole right side, I have, I wouldn't say a lot of pain, but some pain, and then less strength and sensation on my right side left over from that. So had the ribs taken out first, and then that didn't solve all my pain and muscle spasm issues. So then went down the fusion pathway, which is a terrible thing to do for people with Ehlers-Danlos. Because what it basically does is once you fuse a block, then it puts that much more pressure on the next vertebrae above and below. And Ehlers-Danlos patients have lax ligaments. So if you have two vertebral bodies that have lax ligaments, then that pressure just injures those ligaments that much easier.
When did you find out about Ehlers-Danlos?
Ehlers-Danlos probably in the last couple of years, like since I've done the fusion, and I've met with different either yoga teachers or physical therapists. No MDs, none of my like spine surgeon or neurosurgeons recommended. It was mostly physical therapy type people said it was no brainer to them that I have Ehlers-Danlos, right. And I hadn't really heard about it. So now I'm seeing a doctor who specializes in Ehlers-Danlos, and then a physical therapy group that specializes in Ehlers-Danlos.
Excellent. What would you say? How would you summarize the result of all this physical limitations or symptoms you have? What does that result in your day-to-day, like say looking at screens all day or sitting all day, like your job would demand?
So what it comes, the basics of the geometry of what I have from here to here is I have a head that's loosely attached to my spine. So it wobbles around a bit. And when it wobbles, it pinches on the spinal column. So I get, in additional nerve responses, cranial nerve responses that I'll talk about in a minute, up to my head. But also then get like drop foot and foot responses. Like I have a hard time picking my foot up off of the ground. And so it's a head that's loosely attached to then a stump of 5 vertebrae that are fused together. And they're sitting on top of T1 that normally would have 2 ribs holding it in place, but my T1 does not because I've had the ribs removed. So my T1 moves around a little bit more than it should. So I get excess pain and discomfort from T1 down to T2. So I'm fearful that inevitably I'm going to have to then fuse at some point down to T2 to at least get down to the rib cage to get more stability to it. But it's.
And what happens when your head is bobbling? Like what effect does that have on your?
Yeah. So when my skull slips, the first thing it does is, for me, is the 8th cranial nerve. And because I have the twist in my spine, my 8th cranial nerve has been getting pinched since I was 19, really. 19 years old is when I had my first vertigo attack. And was labeled with Meniere's disease at that point, which is basically a junk box full of symptoms that they can't really explain. Mine was easier to explain because it's clear that my 8th cranial nerve is getting pinched, and my symptoms back years ago could come and go with chiropractic adjustments. Mm-hmm. And what happens when think of it like a water hose. Your signal's getting sent, and then you pinch it here, and your brain's not getting signal from your vestibular canal for balance over here. And it's that intermittent on and off that confuses the brain, and then things start spinning. And often I would fall down, throw up, and basically be out kind of for the rest of the day. It would leave you like just exhausted and drained kind of feeling. And I would often eat salty things to try to ease the nausea. But that's one part. So that's the vertigo. Oh, right. Then also when I was in my 20s, I started getting the tinnitus. I would actually get a ringing in my ear that would warn me that I was about to get a dizzy spell. But by the end of my 20s, and I started losing my hearing as the tinnitus started. By the end of my 20s, I was deaf in my right ear. The tinnitus is constant and roaring, and depending on how irritated it is, gets really loud, and then deaf in the right ear. But there still were, even that back then, I would get upper cervical adjustments, and I would start to get just a little bit of hearing back. And it's happened, but it doesn't never sticks.
Yeah.
So let's say I'm standing at a workstation, or sitting at a workstation, when I'm vertical basically, and the weight of my head is pushing down, it starts with where the highest amount of ligament damage is right on the right side at my C2, C3 junction. And that goes into, the muscles go into spasm. That's pretty much as soon as I stand up. And then that spasm carries on up through the side of my skull. And then it also goes down my back to just below the scapula. And then as the spasm pinches other nerves, and I get sort of some numbness and sometimes pain down my arm. But so with the head, first it's just the pain of the muscle spasm. So it instantly starts pain. And then I get a headache, because as the skull moves, it interrupts the cerebral spinal fluid flow. And that's what generates the sort of migraine headache that you start getting. And then I have sort of prickly heat feeling all on this side of my skull and on my face. I can sometimes start getting an eye twitch, and I have a knife stabbing kind of pain in my right eye. My right ear, the tinnitus just starts getting louder and louder and louder, and more distracting. There's times when you can just don't really think about it, notice it, and other times you can't ignore it. And when I'm standing upright, then it gets loud to where I can't ignore it. You almost kind of feel it. And then I'll start getting heat or cold on the right side of my tongue, and have it's hard to describe the taste. I could taste something different on the right side of my tongue. And then my vision can go blurry and fuzzy. So it gets really hard to read. I'll often have to hold things out here or in here, or sometimes just can't. And it's makes the headaches worse to then try to focus in on letters and read. So I'll often, spend just so much energy reading each word in a sentence, and then getting myself back to the other side, the next one, that I just forget what I'm reading. So I've become an extremely ineffective reader, which is very difficult in every aspect of everything.
What about reading maps? Is that any easier?
Maps are a little bit easier because they're shapes and colors, and I can certainly handle that better. Right. It's the finer details. Right. If you're trying to read something at a small detail, like say 11 or 12% font, then that's really difficult.
And what about writing?
What's that?
What about writing?
Handwriting?
Handwriting or typing?
Yeah, typing. I've never been a great typer, so I'm kind of one of those that have to look at the keyboard to type. So, that's looking down, and looking down. I think we all know these days from just general ergonomics that looking down at our phones and tablets and all that stuff is bad. So, for me, it's extra bad, which is why I wear these collars now. And so, where were we?
Well, doing reading, writing, and what about listening
reading,
in a meeting or?
Yeah, reading is really difficult. I get the tongue things. Oh, then we'll just finish down. Then we'll talk more. But I also will can start getting a stutter. And this is like if I just stay up longer and I'm not wearing some kind of a collar. I'll talk more about the collars after. But just standing up, then it'll go on to, I'll start stuttering. I'll start biting my lips or tongue or cheeks. Like my jaw just starts getting less coordinated. My mouth can go like complete cotton mouth. Like it goes completely dry. and then I can move my head around, and then all of a sudden I'll be flooded and drowning in saliva. So all of those cranial nerve responses start getting in, and it all is how I'm either holding or moving my head. Another key thing is that when it hit, it kinked things over, and my third cervical vertebra got twisted. So straight from my head is really kind of a little bit cocked to the left and back like that. So now that everything is fused, that whole section, that twist has been solidified. So I really can't turn my head to the right. I can, but I'll start doing damage to the ligaments. And then that's just more pain and more, all the other symptoms start getting worse the more I try to look to the right. And so there's workstation stuff where I'm turning my head, left to right, looking at 2 monitors. That gets very aggravating to the nerves. But then in group settings, in meetings, there's often people all around, and single-sided deafness is difficult on its own right. It itself is a disability. I'll always try to put myself in a room so that I've got most everybody to the left of me, and then I'll be cupping my ear and doing this kind of thing. It's not always easy to do that. You end up with people on your right, so you end up with someone. I generally tell people on my right that, hey, I'm deaf, so just hit me if I'm not responding to you and you're asking me something. But even still, to hear them, I have to crank around to the right and then cut my ear and then try to hear them. So in meetings, what happens with single-sided deafness is sound waves go around the room, and there's actually an instantaneous kind of delay that happens of when the sound gets to your left ear and to your right ear. And the brain is able to filter out noise that way and focus in on voices and things that you want to hear in the field of noises in there. If you just have one ear, then it's just like sticking one microphone in the room and it sounds real chattery, like a crowded noise kind of sound. And it's hard to pick out individual voices in that. So meetings would work best for me if I'm in a certain position where I got everyone to the left of me and only one person is speaking at a time, and it's generally a quiet room.
Right.
Of course, not all meetings are like that at all. So, and whether it be luncheon meetings or meetings in the office or elsewhere. So I missed a lot.
Yeah.
I walk out of rooms and just really don't know a lot of what was said, and then I'd have to ask people that I was just in the meeting that, hey, what happened with this, what happened with that. Sometimes I'll ask questions and they'll be surprised I don't know something because it had been talked about, but I missed it. So I missed a lot of things that way. I've been asked a lot on doctor questionnaires about memory, and I really haven't checked that I have memory problems. I don't know that I have memory problems. I definitely have problems remembering things, but I think a lot of it is that I'm constantly in a distracted state. I'm always making some sort of an adjustment for, a pain or cotton mouth or any one of these symptoms. It's just, it's all encompassing, and there isn't a minute in a day that goes by that I'm not aware of something inside my body that's screaming out saying don't do this or move this way or whatever. So yeah, in that too, I'm constantly distracted, and I miss a lot of what gets said. And then I may miss things in the presentations and whatnot, and then I go back and I have the data room, like the presentation booklet that I flip through, but I can't read the words in it. I'll read what I have to and, focus in, and I often have a magnifying glass to look at things. But as far as reading a paragraph or reading, a small section of bullet points, it's just the process of reading is so discomforting that I rarely remember really what I've read by the end of it.
Right.
Yeah.